Question 71. When helping a disabled person with ADLs, the nursing assistant should A. Encourage the person to work in order to learn. B. Encourage as much participation as possible. C. Avoid praise and positive feedback. D. Do everything for the person in order to save time. Answer B. Explanation. Every person should be encouraged to be as independent and active as possible. Participating in their own ADL is important, and often tasks can be adapted to accommodate disabilities. Even people who must remain in bed can often still participate in their care. They can move and turn in bed during a lean and change. Question 72. To give their residents complete privacy, you should A. Always close the curtain around the bed when you give care. B. Close the curtain around the bed if the resident has a roommate. B. C. Pull the curtain around the bed only if the resident asks you. D. Provide care with the room door open. Answer A. Explanation. Privacy is a basic right for all residents. Privacy can be physical, as when closing the curtain each time when you're giving care. It can also protect resident information and medical history. Question 73. TED holds anti-embolism applied. A. While the resident sits in a chair. B. Before the resident gets out of bed. C. 4 times a day. D. After the resident has ambulated. Answer B. Explanation. Elastic stockings or anti-embolism stockings are used for patients who have had surgery or are unable to ambulate. Make sure the size is correct for the patient before starting. Assist the patient to lie down in a supine position. The patient's feet and legs should be dry. Roll the stocking inside out all the way to the heel. Fit it on the foot and heel, then roll it up onto the patient's leg. Smooth any wrinkles and make sure the stockings are straight. Talcum powder can be helpful to prevent friction and rubbing on the skin. Question 74. Why do residents with Parkinson's disease require assistance when walking? A. They have an attention deficit and safety issues. B. They have limited peripheral vision. C. They are perplexed and forget how to take steps. D. They have a shuffling gait and often get tremors. Answer D. Explanation. Parkinson's disease is a chronic movement disorder that gets worse over time. Patients develop tremors in the hands, arms, legs, and face. They walk slowly with a shuffling gait. About 70% of patients fall because of balance problems, so assisting them when walking may be necessary. Question 75. When helping a client use the commode, it is essential that A. Stay with the client until they have finished using the commode. B. The call button light is within easy reach in case they need help. C. The door is locked so they have privacy. D. They are restrained to prevent a fall. Answer B. Explanation. After helping a client to the commode, giving care, or when leaving client's room, always ensure that the client's call signal is within reach. Clients must always have access to their caregivers. Restraints may never be applied without an order from the client's doctor. Question 76. Which of the following is true about caring for a resident who wears a hearing aid? A. Replace batteries weekly. B. Apply hairspray after the hearing aid is in place. C. Clean the ear mode and battery case with water daily, drying completely. D. Remove the hearing aid before showering. Answer D. Explanation. Hearing aids are expensive devices and care must be taken to avoid getting them wet. If a hearing aid does accidentally get wet, turn it off and remove the battery. Dispose of the battery. Open the battery door and allow the battery to completely drain out, which can take a day or two. Insert a new battery before using it again. Question 77. Which statement about seats bath is true? A. The seats bath can last up to 60 minutes. B. The pelvic area is immersed in 80-degree water. C. The water is at the level of the heart. D. The purpose is to clean the perineum and relieve pain. Answer D. Explanation. A seats bath cleans and soothes the perineum, promotes healing and reduces pain. It is often recommended after rectal surgery or vaginal birth. The water is about 100 degrees, a level of about up to the hips. A seats bath lasts about 20 to 50 minutes. Question 78. Mr. Francis is blind. When ambulating him, you should walk A. on the right side, B. behind him, C. on the left side, D. in front of him. Answer D. Explanation. When assisting a client who is blind or has low vision, allow them to hold your arm so you can guide them. Touch the back of your hand to the back of theirs so they can move their hand and locate your upper arm. They should hold on above your elbow and walk half a step behind you. Walk at a place that is comfortable for both of you. Question 79. Before giving a back rub, the bottle of lotion can be placed in a basin of hot water for several minutes so that A. the lotion will be easier to apply, B. the lotion will relieve itching, C. the lotion will not be cold, D. the bottle is sanitary. Answer C. Explanation. Lotion should be warmed before applying it to a patient's back. You can rub it between your hands or place it in hot water to get it warm. Question 80. When helping a client to eat, the first thing a CNA should do is A. Wash the client's hands, B. Give the client some privacy, C. Make sure all food groups are present, D. Cut the food into bite-sized pieces. Answer A. Explanation. Washing hands before eating is important for everyone. The CNA should wash their own hands as well as the client's. The client's hands can be soiled from touching objects as well as their noses and mouths between meals. Even if the client is being fed, they may touch the food or their mouths during the meal, increasing the risk of spreading germs. Be sure to wash under fingernails, which can carry the most germs. Thank you for watching.